Dr. Sheila Barbarino. I am out of Austin, Texas, and Redondo Beach, California. I am an oculofacial plastic and full body cosmetic surgeon. Patients struggle to articulate what they want every single day in every way possible because they don't have medical school background. They don't have the knowledge and the tools to explain to us what exactly their problem areas are, what bothers them about their face or their body. So oftentimes patients come in and say, I look tired all the time, or something. I look sad. People think I look angry all the time. Why do I look angry all the time? What can I do to make me look less angry? How do I look prettier? How do I look like the best version of myself? Everybody wants to be and feel and look like the best version of themselves. Like, who doesn't want that? Patients, on top of the nervousness and getting to know you as a provider, they're not doctors, so they don't know these things. And it's our job to inform them and educate them. But we also want to educate them on their result, what's going to happen, how they're going to look afterwards, right? And the treatments that they need to get to that result. And so I think Ageless AI really gives a great picture that, the old adage, a picture is 1,000 words, which is absolutely true. And if I could say 1,000 words less a day, that would be, time is money. And I think that would make my consult that much more efficient. The AI generated after gives both me and my patient the confidence to know that we both are understanding and speaking the same language, and we both have the same goal to move forward. And it gives them the confidence that I'm the right provider and this is where we're going. And it gives me the confidence as a provider that this is what an acceptable cosmetic result with the tools in my armamentarium are going to get them. They have this tool now that can show their provider exactly what they're interested in, what their concerns are, what they want to look like afterwards. There's so many times that I do patients' lips, or, can you give me an example of what you want your lips to look like afterwards? Just like this. Look, this is my Ageless app. This is how I want to look afterwards. And it's so easy. It's like, what is it? Paint by numbers, so I can see what their ultimate outcome, what they're looking for. Any patient that already knows what they need, that's educated about the procedure, and knows approximately, within reason, how much that procedure is going to cost, is everything for a physician. Because the last thing we want to do is disappoint our patients, and for a patient to come in thinking, I've got this much money, X amount, and it's not even close to the amount of what they need to spend to get them to where they're going, is heartbreaking on both sides, the physician side or the provider side and the patient side, right? Because, I think everyone has the right to look their best, and I want to deliver that, and I don't want money to be the barrier, but it is for a lot of patients, right? So, an informed patient, educated patient, number one, it takes down the consultation time. Number two, makes our time together more valuable, me and the patient, during our consultation, because they're asking more informed decisions and questions versus just random things that they heard on social media or the internet or their friend who has had the procedure told them, right? So it's more of a focused consult. It's a quicker consult. And on top of that, everybody feels good. I feel good about moving forward when the patient really understands what we're going to do and what's going to happen. And for some tool to kind of give them those, the Reader's Digest version before they come in and see me, I can honestly say that when patients come in to see me on the first time or second time, sometimes they're nervous and they don't really hear what you're saying. So for them to be able to read it, digest it, and come in knowing ahead of time kind of what I'm going to say and what I'm going to do really puts them at ease, it puts me at ease. And like I said, the last thing I want is for finances to be a barrier, so they know approximately how much it's going to cost when they walk in the door. So there's not this sticker shock or anything like that happens. In fact, sometimes patients are like, well, I've been researching it. Some people charge this much. I'm so glad that you've broken it down for me, and I can kind of make choice of this or this, and not have to spend it all at one time. So Ageless AI, I think it's great because it, like I said, it pulls from my my price list and puts together kind of a package of what they may or may not need, and kind of gives them a price range, approximately how much they're going to spend to get this result. And I think it's fairly close to where we probably will land. And so, like I said, it might be a couple hundred here and there, but in general, they'll have like a ballpark figure. I mean, how many times a day do we get phone calls asking, how much does Dr. Barbarino charge for this? And then they come in, and what we figure out is that they actually don't need that. They need this and this, right? But they only budgeted for something else. None of us get through the day without using AI in some fashion, whether it's in our practices or in our personal life. The practices that don't have AI moving forward will quickly fall behind, because if I'm a patient and I come in to see a provider that can show me a before and after that's me versus a before and after of someone else, and me not be able to see what I'm going to look like after, it will be very difficult to go with the provider that doesn't believe in technology and can show me exactly what I'm going to look like after. Every day we are innovating, we are getting better products, better tools, better lasers, better skincare. It's all about innovating. And I think that an AI app like Ageless is just part of that whole movement in our practices, right? Regenerative medicine. We want to not only, look good, we want to feel good, we want wellness, we want all of that, and we want to see it ahead of time, right? Why not? Why can't we do that? We are of the generation that everything's at our fingertips. So why can't I see what I'm going to look like in 15 years? Why can't I see what I'm going to look like if I had a facelift and fat transferred to my face? Like, I want all the things and I want it now, right?